I'm Jason Tartagline. I'm an orthopedic surgeon at Ortho Rhode Island West Bay. I specialize in general orthopedics, orthopedic trauma, as well as orthopedic foot and ankle surgery. Well, we're in the middle of March Madness, so I guess it's time to talk about ankle injuries. Ankle sprains exceedingly common in basketball. Patients or athletes come down on their ankle, they have an inversion injury where the ankle goes in and the outside of the ankle, there's some tension in the ligaments, they break essentially. And when those ligaments are injured, that is an ankle sprain by definition. When looking at this, you can note that there's a significant amount of soft tissue swelling about the lateral side of the ankle. That's the outside of the ankle next to this long bone called the fibula. This other long bone is called the tibia. It's a much larger bone. And the last bone is the talus, which rides underneath them here and creates what we call the mortise. And this is the ankle joint itself, or the tibio-talar joint. An ankle sprain occurs to the ligaments on the outside, and that is right here that connects the talus here with the fibula. There's also some other ligaments about the ankle. Another one is the deltoid ligament that is a main stabilizer here. And there's some other ones up here that connect the two bones between each other, often noted as the high ankle sprains. When someone inverts their ankle, the foot goes in sort of this way, and there's stress and tension on the outside here of the ankle, and these ligaments are torn. And in treating ankle sprains, vast majority of patients, which is a good thing, can be treated without a surgery. Treatment is the general RICE therapy, which I'm sure lots of people are familiar with, which is rest, ice, compression, elevation. But then there's other things like immobilization in boots or casts, activity modification, anti-inflammatories. And then with physical therapy, most patients can get back without any type of surgery and get back to life without any problems. I hope everyone's enjoying the end of March and the tournament. My bracket's already been busted. My teams are out. I hope your teams are in it and that your brackets are doing much better than mine. Have a great day, and thank you so much for watching.